everyone!
Hi guys!
Welcome to our Facebook Live today. My name's Ellen.
And I'm Shani.
Today we'll be talking about chronic fatigue syndrome, different kinds of things that can influence it, different things that we look at as naturopaths to do with chronic fatigue, different kinds of testing that we can do for it, and different kinds of treatment as well. So it's something that we see pretty commonly in the clinic on a day-to-day basis. So it's something that we have dealt with quite a lot as naturopaths. So to look at different kinds of symptoms that might go along with chronic fatigue, obviously fatigue. What other things, Shani, do you see in clinic?
Fatigue is definitely the biggest one, obviously, but then looking at other things that people could potentially be suffering from as well, which may be some mental health signs and symptoms, so possibly some anxiety, depression, insomnia, irritability, all of those kind of things we do see quite often go hand in hand with chronic fatigue as well.
Yep. And the things that we look at as naturopaths are quite in depth in terms of the chronic fatigue. So things that we look at a lot for triggers. So a question that I generally ask people is, when have you never felt well since? And generally this is a really good question to be able to find out the answer, what a trigger might have been. So whether it was some kind of big stress in the life, whether it was some kind of big illness, operation, something like that could have triggered it. Pathways that we look down can be towards the adrenals. So your adrenals is a lot to do with your stress response in the body. So looking at that cortisol response that could be impacting it. There's different kinds of tests that we can do to see how the cortisol is tracking in the body as well. So this can be generally a good indication to be able to tell us if there's anything like adrenal fatigue that could be linked with the chronic fatigue. And Shani, you were talking about the viral aspect of it as well.
Yeah, so a lot of the time we do understand, and most of our patients who come in with chronic fatigue have a little bit of a feeling that they've done some research and feel like, oh, I'm adrenally exhausted. And while this can be a component of what's going on for that person, we still need to look at every single person as an individual and assess everything that could potentially be correlating to their chronic fatigue in their body. So a lot of the things that I see quite frequently and always question with my patients is potential viral loads that they may have. And what I mean by that is that when we have any kind of virus that can enter our system, these potentially can lay dormant for a number of years and can flare back up. And this is something that I definitely find we see very frequently, and unfortunately in the standard medical industry there's not a lot that we can do that we can have antiviral effects, but in natural medicine there's so many incredible herbs and things that we can do to actually work on those viral components and therefore improve significantly that fatigue picture.
Great. Other things that we look at is to do with the gut health too, because there's a massive link between gut health and fatigue or any kind of nervous system kind of issues going on. So that link between gut and the brain, again, is a really big thing that goes on with chronic fatigue. So I guess looking back to the viral load, looking if there's any kind of bacteria, yeast, parasites that are influencing what's happening with the good bacteria levels. So you need the good and the bad stuff to be even in the body, not the other way around with having too much bad stuff, not enough good stuff, because the good bacteria is what helps with things like your serotonin and your melatonin production, and this is what helps with things like fatigue and helping with your adrenals in the long-term scheme of things. So So like Shani said, we have lots of great herbs and nutrients to be able to help with all of these things that may be happening in the body. And we have a lot of great investigating tools to be able to see what's going on in terms of testing, to be able to get some answers for people who are going through different kinds of symptoms that are similar to chronic fatigue, or if they've been diagnosed with chronic fatigue. So it can take a little while for people to be diagnosed with it as well. So this is something that we see in clinic quite often, when people are just not feeling right and haven't felt right for a long time, but they have no diagnosis, is something that we can help with. Anything else, Shani?
One of the other big correlating factors I find as well is questioning what's happening with our liver. So one of the biggest jobs the liver does in our body is it actually works to detoxify and cleanse our blood. And this day and age, we have so many lifestyle impacts that slow down that liver detoxification, and therefore we can build up with different toxins and hormones and heavy metals and what have you. So assessing liver function is something that we're always considering while we're chatting to all of our patients, and generally we will look at upregulating this to make sure that we get more of those toxins out, because if we do have more of that toxic load that's in the system, of course we're going to feel more fatigued and crappy for it, essentially.
Yeah. And there's great herbs that we can use to upregulate the liver detox pathways and keep it nice and healthy. And then of course looking at nutrients, nutrient status in the body, because your liver and all of your pathways, like your adrenals as well, are very reliant on a lot of different kinds of nutrients in the body. So if you haven't had any blood tests done in the past year or so, it's something that I always get patients to do as well, to be able to get a really good idea of what's actually going on inside, and if there's certain kinds of nutrients that could be low, that could be also affecting the fatigue in the body. So that's something I always like to do as well. Hi Marina. If you have any questions, please leave it in the comments, and we'll be able to get back to you. But thank you for listening, and we'll catch up with you soon.
Thanks guys.
Okay.
Enjoy the rainy day.
Bye.
See ya.